इसमें भी आवाज नहीं आ रही, इस पे तो वो है ना। अरे सर बात तो हो गई, लेकिन उनको मेरे को भी उनकी आवाज नहीं आती। कुछ बोल नहीं रहे।
हेलो
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 सर, वी कैन हियर यू. हाँ अनुज,
आ गया
आ रही सर, आवाज आ रही सर.
इस पे है यार। यस सर, आ रही है मोबाइल पे आ रही है। इसको लीव करके दोबारा इसको लीव करके दोबारा सेंड करते हैं।
हेलो सर. हाँ
हेलो इसी पे बोलते रहिए और वहां से देखते रहिए, कोई दिक्कत नहीं होगा, आपका ऐसे ही जाएगा। हाँ अब जा भी रही है बस।
Namaskar and a very warm good evening to everybody. My name is Anuj and I welcome you all to this second webinar of the sixth series, conference series, knowledge series on this Saturday evening at 4 p.m. So we are very happy that leading experts from the different parts of the country have joined us for this webinar series. It's heartening to know that our last webinar that we started, the first webinar series that we did was for the respiratory diseases, the chronic respiratory diseases. And I'm very happy to share with you all that till now we have garnered more than 1,000 views on the YouTube channel. So first and foremost, my sincere thanks to each one of you for making the webinar so successful. Thank you for sparing your valuable time and coming to us and sharing your knowledge. Building on that context that we did for the last time for the webinar series on the chronic respiratory diseases, this time, very aptly, we have chosen the topic of chronic digestive diseases or chronic digestive disorders, as we may call it. The context that I have built is, if I can just go and share the screen with you, is that if you look at, uh, this is a very recent article that I was going through, which says that apart from the respiratory problems that are faced by the COVID patients, it is increasingly very common that majority of the patients also face digestive symptoms and problem pertaining to digestion, right? And this is a recent article that was published in the American Journal of Gastroenterology, in which it mentions very, very clearly that more than 48.5% of the patients, COVID-19 reported patients, they had symptoms pertaining to the digestive systems, right? And this is a study that was done in the China, in the province of Hubei province, which was the epicenter of the COVID-19. And this is a trial which was recently published in the American Journal of Gastroenterology in the month of May, which says that the clinical characteristics of the COVID-19 patients pertaining to the digestive systems. And this is a descriptive cross-sectional multi-center study. And as you can see in the graph, my dear doctors and friends and others, is that the frequency of COVID-19 patients with or without the digestive systems is plotted in the graph. If you look at very closely, 9% is patients which are without the digestive or not the respiratory symptoms, which is very meager, right? 3% is with the digestive system and without the respiratory, so there's no overlap. Both the systems symptoms are very different. 41% patients, they suffer from respiratory system symptoms, right, pertaining to the upper respiratory tract and the lower respiratory tract, 41%. But the majority of the patients, if you look at 47, a very huge patient population, suffers with dual symptoms of the respiratory system as well as the digestive system. Hence, we started with building on the first topic, which was the chronic respiratory diseases, and then we have dived deep into the second subject, which is the chronic digestive disorders. So I think the context is very well set. And this is, if you can see on the screen, this is a statement given by the Li Pen, who is the MD and PhD at the Department of Respiratory and Critical Care Medicine in the Binzhou Medical University Central and Hospital in China. And the researcher has very clearly said that clinicians should recognize that digestive systems, such as diarrhea, yeah, may be presenting feature of COVID-19, and that the index of suspicions may be needed to raised earlier at risk patients presenting with digestive systems, rather than, this is a very important line I like to draw your attention, rather than waiting for respiratory symptoms to emerge. So as we have seen in the post-COVID era, that majority of the patients first, the onset of symptoms is on the respiratory tract. But the clinician here, Li Pen, very clearly says that it is not only the digestive systems symptoms, but also the respiratory systems, which are equally important. And hence, there has to be a lot of focus in not only treating the respiratory system but problems, but also the digestive system problems. So with that context, let me welcome you once again all. And we are fortunate again to have the chairman of Mahasi Ayurveda, Shri Anand Srivastavaji, who has consented to join us again. And may I request the chairman of Mahasi Ayurveda, Shri Anand Srivastavaji, to please go ahead with the address and welcome the panel of the doctors, and highlight the importance of the digestive system as is mentioned in the Ayurveda text. Over to you, Chairman, sir, for the address.
Namaskar. It's a great pleasure to welcome all the great scholars of Ayurveda and the practitioners. And I welcome Dr. Shishadri. I welcome Dr. Anand. Dr. Anand Dasputre, and Dr. Ragini, Dr. Pradeep Segal, and also Dr. Saurabh Chand Gupta. It's a great, and also it's my great honor and pleasure to welcome all the practitioners and also the audience, all the people present in this webinar. I have recently come across a very interesting shloka. It says, "Pathe sati gadartasya kim aushad nipe gunai." And the second line is, "Pathe sati gadartasya kim aushad nipe gunai." Meaning, if the person uses the right food, right diet, he does not require any aushadhi. I mean, there's no use for aushadhi for him. And also a person who does not follow the right diet, he will also not require any aushadhi, because no aushadhi will work for him. So the importance of food and of course its digestion is very high in Ayurvedic medicine, in Ayurvedic system, and it's a good subject. Digestion itself will be contributing greatly in the area of immunity, and that way certainly will save from the present situation, present pandemic, but will also be helpful for us, for the whole humanity all over. So I'm sure all the experts, they will be explaining about the digestion and pathya to everyone, and all the doctors present here will give more importance, very high importance to this great subject. So I once again welcome everyone, and would like to request to please share your experience and your knowledge with everyone for the benefit of the whole society. Namaskar.
Many thanks, Chairman Sir, for the address and for those guiding words. We are indeed delighted to have you on the panel and for your encouraging words of wisdom. Thank you, Chairman Sir. So moving on, the first speaker for today, we have all the way from Bangalore, Dr. Sheshadri BV. Dr. Sheshadri comes with an experience of more than 40 years. I mean, 4 decades of experience straddling into the management of various chronic ailments, and his expertise is in the management of the digestive disorders. And he is currently the professor and head, the vice principal at the Indian Institute of Ayurvedic Medicine, Research and Hospital, Bangalore. He has been the guiding Ayurvedic doctor at the various institutes, the chief Ayurveda consultant at the BML, the HMT, the Central Power Research Institute at Bangalore. Dr. Sridhar has also worked as a guide in the Bhagwan Mahavir Ayurveda College and Hospital, which is a prestigious hospital in Bangalore. And very recently, Dr. Sheshadri has been awarded the Dhanvantri Puraskar from the Karnataka Parishad. Dr. Sheshadri has been very active in the various diasporas to propagate the holistic benefits of Ayurveda. And we are very fortunate to have you, sir. And I'll request that you please go ahead with your address. So to Dr. Sheshadri, over to you, sir.
Namaskar for all my elders and youngsters. Can you hear me, sir? Is connection there?
So we can hear you, sir. So we can hear you, Sheshadri, sir. Please go ahead, sir. Please go ahead, sir.
So this is a happy occasion to meet all our seniors, juniors, practitioners, teachers all over the India from various states and various stages at various levels. And some of them are teachers, some of them are research officers, some of them are in practitioners, some of them are consultants, some of them are aiding with the government hospitals, some of them are private. So for everything, my heartfelt, sincere namaskar. The topic of the day is the importance of digestive system and its diseases. In my view, I am MD from Kaya Chikitsa mainly. I practice this Panchakarma, I practice this Kriya Shari and all. So in this way, when I went into the subject wise, see we have got 3 main grahas in the system, solar system, that is the sun, moon, and the Vayu. Okay. And we have got accordingly a system is framed in our body. One is Pranavaha Srotas, Annavaha Srotas, and Udakavaha Srutas. Pranavaha Srutas is controlled by this Vayu. Annavaha Srutas is controlled by the Surya. Udakavaha Srutas is mainly controlled by the moon. But in our study, our acharyas, who are all great rishis and maharshis, Charka, Acharya, has explained the mulas for these Pranavaha, Udakavaha, and Annavaha Srutas as a Mahasrutas. What is this Mahasrutas is one of the important questions. Mahasrutas has got two channels which originate in the face. One is the mouth, another one is the nose. Through these passages, air will enter into the body, water and food will enter into the other channels in the mouth, in the face. And this has got an interrelationship. One cannot live with the other. One cannot live without the other, brother. Why means when we are eating food, we will be breathing. When the food is becoming excess, we drink water. We cannot always have a hot food. We have the water added again and again during the food. See that air, water, and food will be taken proportionately into the body. That is called as ingestion. That is ahara sema. And once we say the ahara, we come across various food. Various food means we have got purely vegetarian food, purely non-vegetarian food, or food which is mixed up of both. In the vegetarian food, what we got alahar, upahar, pranahar, whereas in non-vegetarian food, we have got a meat.
Sir, can you keep the mic little closer? It's we cannot hear you. Can you keep the earphone little closer? Your voice is little not audible, sir.
Okay, not audible. Okay, it's a little louder. Okay, sir. Thank you. See, when we say we have got a non-vegetarian food, we have got this mutton, meat, fish, egg, and mixture of fish in the form of a prawn or a crab. This is called as ocean food. But when we are consuming the food, we'll be having the mixture of the food in various form, and we'll add the spicy food, spicy materials, pepper, the sagas, other combination of dhania, chili powders, red chili powders, and artificially made soda, and all these make a taste. And we want to have a ruchya. Before we take the food, we will have a ruchya. Ruchya means we want to have a taste first, then the quality of the food. What will be important for the taste of the food? We consume the food. Some of the people who are mainly the vegetarians will be having the sattvic ahara and balancing food. Balanced food means what? We have got Shadrasa Pradhan. We have the Madhur Rasa Pradhan and Lavana Ras. Some people will have Amla Rasa Pradhan. Some people will have the Katutikta Kashaya Pradhan. And we have got a habit in South India that we will mix the sambar with the tamarind, which is a chara. So we have got seven rasas put together into making into a rasa, and that is consumed in the form of a food. And we have got the way of consuming the food. What we will have morning food, evening food, night food, middle food, everything. But this is the one which is not specified as per the classics, and it is not good for the health. One should have one palahara a day, one upahara a day, one mukha ahara a day. If they have got one ahara a day, he is ever yogi. If he takes two types of food two times in a day, he is yogi. If he takes three times and more, he is called as a rogi. See, we have got the food which has to be taken only 2 times a day, which is classically, scientifically welcome. And among those two food also, one should be normally heavy food and other should be balancing small food. What we do is when we take food, we'll have so long, we have got a coffee, we have got a tea, or a beverage, or a drinks in between. And what does this food makes? This food, when it is taken in a disproportionate way, with a Ayurveda by force by the team, then it will disturb the Siddhanta. What are these Siddhantas for the Ayush? Siddhantas are Ahara first Danda, Nidra is the second Danda, and Brahmacharya is the third Danda. This is called as the Danda for the Adhar to achieve Purusharthas. The first, when the Ahara disturbs, next it will definitely disturb the Nidra. When once they disturb the Nidra, Acharas cannot be followed. So the food is the one which is most important. And we have got every time in the world we are anxious, we are tensed up. Right? We want to finish off the work faster, faster and faster. But work will come again and again, again and again. We have no plan. You want to have sleep? No specific time. Why? We want to work. We want to work. Why? What work do you want to do? So we have got a specific time. We have to definitely sleep in night. What we do? We will wake up in the night, have food in night. The food is mentioned many decade time, where the Surya is active. You have your food. When there is the moon, you sleep in the night. When there is Vayu, you have a proper defecation, Malamutra Visarjana, and then take a bath, do some yogasanas, you do prasanas. The acharas, vicharas are also to be added. Then the digestion process will be proper. If we eat over and over, because there is no time, we want to get up and get up. Hurry, hurry, hurry. We have put
Yes.
ourselves into a stress. And what is necessary? No, we'll have sufficient time for eating food. What type of food we will have? We'll have manda, vileti, khadya, bhojya, bhakshya, lidya. What are these? We have to have in food. We should have a tasty food. And when we have a tasty food, you should be santapana. You should pacify our mind. You should be satisfying our atma. We should be comfortable at this time. In case if you have very worried, whatever food is available, let me eat it, gulp it, drink water to flush it to do better. In a modern time, we compare this smart process to be the midgut. Midgut is the one start from the mouth and to the end. Uh, Midgut is the one we start from the mouth and ends with the and one person asked, what is it? Started to description of the digestive system. The digestive system is the one start from the right hand, ends with the left hand. Means when you are taking the food from the right hand, it should be clean and proper, and it should be.
So I think we have some audio problem from the doctor. So I think the audio, there's some audio problem with the doctor. We'll request Dr. Saab to kindly look into that, and we'll get back to you, Dr. Saab, in the question answer session. So Dr. Sheshadri, thank you very much for opening the session for us. Moving on, we have Dr. Pradeep Sehgal from the city of Ambala. Dr. Pradeep Sehgal has been the esteemed member of the Indian Science Congress Association and the World Academy of Ayurveda. Dr. Pradeep Sehgal has also been an Associate International Congress of Chemistry and Environment. Dr. Sehgal has been awarded the certificate course twice by the Royal College of Physicians, UK in England. And Dr. Sehgal has been recognized as one of the leading Ayurveda practitioners in the state of Haryana, and Punjab. And he has been conferred with many prestigious awards by the state and the Indian government. And he is an avid writer, singer, and a cartoonist. So these are very myriad interest areas that Dr. Sehgal has. And he has a very special interest area in the management of chronic digestive disorders. So let's hear from Dr. Sehgal as to how he intends to treat the patient. Over to you, Dr. Sehgal.
Hello, dear delegates and friends. We are going to the Ayurvedic expertise to deliver. You know, during these times now, the immunity is a very important factor to tackle the growth of the spread of virus. Now, when we see the perspective of Ayurveda, to boost the we need food, and the pushar we do in our whole life, during the lifetime, in this pushar, that needs energy, and that energy can be from the food.
Sir, your
Food
voice
in the form of vegetables, food in the form of fruits, even in the form of Ayurvedic herbs like ginger, tulsi, ashwagandha, shtavari, and all that. श्री कृष्ण ने कहा कि मैं जटायु हूं। हमारे पुराणों, उपनिषदों और में जो बातें लिखी गई, we don't have to take those things very seriously, because उस समय में जो बात कही गई वो बहुत ही श्रृंगारिक भाषा में उसकी विवेचना की गई, बहुत ही सांकेतिक भाषा में सब व्याख्यान किया गया। जब श्री कृष्ण ने कहा कि मैं रागी हूं, तो इससे प्रभाव कर लेना चाहिए कि जटाग्नि कितनी इंपॉर्टेंट है। हमारे आयुर्वेद के 8 अंगों को अष्टांग संग्रह में विवेचित किया गया है। जो सबसे पहला अध्याय है वो काय चिकित्सा है। अब काय चिकित्सा को ही परंपरा क्यों लिया गया? What is काय चिकित्सा?
There is some audio problem with your side too. I think, can you please come near to the mic or something?
Sure.
Yeah, now it's better. Now it's better.
Now I'm audible. I'm audible now.
Yes, very well, doctor. Yeah. Please go ahead.
अब काय चिकित्सा को ही प्रथम अध्याय क्यों दिया गया? क्योंकि अग्नि को इतनी इंपॉर्टेंट हर एक एनर्जी करती है। When we see from the perspective of Ayurveda, जैसे 5 महाभूतों की गणना की, जैसे 5 महाभूत हैं तो 5 क्रियाएं हैं, उसी प्रकार 7 धातुओं की गणना है। रस, रक्त, मांस, मेद, अस्थि, मज्जा, शुक्र, 7 धातुएं हैं तो 7 अग्नियां हैं। इसी प्रकार अगर हम डिटेल में जाएं तो कोशिकाओं में इस अग्नि का प्रादुर्भाव किया गया है, जिसका व्याख्यान किया गया है, पीलू अग्नि, पीटर अग्नि को दिया गया है। And we see it in Ayurvedic perspective. This is very important. And we compare with modern perspective, the mitochondria in the cell, which helps in the metabolism. And what is metabolism? The combination of catabolism and metabolism and anabolism. Catabolism, that is, done by the lysosomes, they are known as the societal bags. That whole process, which is done, our liver is also involved.
If you have an earphone, it will be better, because there's a lot of noise breaking that's happening at this point of time.
Yeah, sure. Why not? Earphone. Hello.
Now it's better. Now it's very better. Please go ahead.
Now, आयुर्वेदा में इस बात का प्रादुर्भाव किया गया कि सभी बीमारियां जठर से उत्पन्न होती हैं। जठराग्नि की इंपॉर्टेंस को डोनेट करती हैं। तो जठर, व्हाट इज जठर? जठर मीन्स द स्टमक, एंड अग्नि इज अ कलेक्टिव टर्म गिवन to the digestive juices, the peristaltic movements, and all the metabolic activities that is going on, in the endoplasmic reticulum and all that, that is the whole process aiding in digestion. Now, अब इस बात की इम्पोर्टेंस है कि जो भी एनर्जी हमें मिलती है उसका जो बेसिक है वो हमारी डाइजेशन है. हियर कम्स द इम्पोर्टेंस ऑफ डाइजेशन. अब होता क्या है कि नॉर्मली when we meet patients and lot of doctors, when we meet, everybody keeps on stressing on the medicines, but the basic concept which is very important, the basic concept of digestion which is very important, is easily ignored. हमारे आयुर्वेद में जो कहा गया सम धातु समाग्नि है, सम दोषा मले क्रिया, हर एक चीज की राइट क्वांटिटी में लेना बहुत इंपॉर्टेंट है. When we take the right amount of food at the right time, तो जठराग्नि प्रदीप्त होती है. And on the other hand, when we take गरिष्ठ भोजन, अधिक मात्रा में लें, असमय लें, तो अजीर्ण की उत्पत्ति होती है. Now, what is अजीर्ण? अजीर्ण is a term given to indigestion. And after that, if that is not cured, what is the aftermath of it? आद्यमान. What is आद्यमान? It is flatulence. मेरे पास कई पेशेंट्स आते हैं इतने सालों से मेरी ओपीडी में, जो कहते हैं डॉक्टर साहब हम कुछ भी खाते हैं तो डाइजेस्ट नहीं होता, लगता है जो कुछ खाया है वो यहाँ पड़ा हुआ है. उस केस में मैं उनको एक छोटी सी थेरेपी देता हूँ. जस्ट हैव अ थिन स्लाइसेस ऑफ जिंजर, add some sort of lemon juice and have it before meals. और जो धनिया है, हरा धनिया है और पुदीना है, जो इजीली हर किचन में अवेलेबल होता है, अगर उसको हम उसकी चटनी बनाकर हम उसको मील्स के साथ लें तो दिस एड्स इन डाइजेशन. सो द वेरी इंपॉर्टेंट थिंग is to maintain your digestive system. If you maintain your digestive system, then your immunity will be higher, and then only we can tackle that growth of virus. हम उस वायरस से तभी लड़ पाएंगे जब हम कलेक्टिवली इस बात को समझ लेंगे कि डाइजेशन का, हमारी जठराग्नि का क्या रोल है बॉडी में. और इसी बात को इंपॉर्टेंस देने के लिए हम यहाँ इकट्ठे हुए और हमारी ये समिट हुई. आयुर्वेद में जो बहुत पहले पढ़ा करते थे, स्वस्थ से स्वस्थ रक्षणम आतुरस्य विकार प्रश्नम च, ये परिभाषा क्यों उत्पत्ति की? क्योंकि अगर हमारा शरीर स्वस्थ रहेगा और उसको स्वस्थ रखने के लिए बट द फूड वी आर ईटिंग, द फूड वी आर ईटिंग इज शुड बी प्रॉपर्ली डाइजेस्ट, एंड दैट कैन ओनली बी डन इफ आवर डिसिप्लिन इज प्रॉपर. We eat right amount of food at right time. These things are very important for the immunity and for the energy build-up. That food taken is, like gold in the minerals. तो ये बात जो शुरू में कही गई थी, मैंने कहा था कि जो ह्यूमन बीइंग्स पुरुषार्थ करते हैं, उस पुरुषार्थ को करने के लिए जिस एनर्जी की जरूरत होती है, उस एनर्जी के लिए हमें फूड लेना पड़ता है. चाहे हम उसे वो विभिन्न प्रकार की आयुर्वेदिक जड़ी बूटियों के रूप में लेते हैं, अश्वगंधा है, शतावरी है, तुलसी है, जिंजर है, या फिर उसको फ्रूट्स के रूप में लेते हैं, वेजिटेबल्स के रूप में लेते हैं. और अगर हमारी जठराग्नि प्रदीप्त है तो हम हमारी इंटेस्टाइन्स की पेरिस्टाल्टिक मूवमेंट्स ठीक हैं, तो विल बी एबल टू टैकल दिस वायरस, द ग्रोथ ऑफ वायरस. दिस इज द मेन थिंग. We all have to understand this thing. These are the things I want to lay stress upon. Thank you, my dear friends. Thank you.
Many thanks, Dr. Pradeep Sehgal, for the insightful lecture that you have given about the various approaches that you as a practitioner has taken to address the ailments of the various digestive rather chronic digestive disorders at your practice, and I'm very happy that majority of them have been successfully treated from your side. Moving on, after Dr. Pradeep Sehgal, from the city of Chennai, we have Dr. Ragini H. Chandrasekhar. Dr. Ragini is presently working as a consultant Ayurvedic physician at the Maharshi Vidya Mandir, Hosur, Tamil Nadu. Dr. Ragini has previously worked at various Ayurveda medical colleges in Bangalore and at Tumkur in Karnataka. Dr. Ragini has also participated at various seminars conducted at both national and the international arena, and she holds a master degree in the Reiki also and a certification in acupressure. Her areas of interest, apart from the various chronic disorders, lies in the management of the digestive symptoms or the digestive disorders, and she actively participates at the various national and international forums to propagate the benefits of Ayurveda. So may I request Dr. Ragini to please go ahead and address the webinar. Over to Dr. Ragini, please.
Thank you, Mr. Anuj. Am I audible?
Yes, ma'am, you're audible. Please go ahead, ma'am.
Yeah. So a warm good evening to all of you, and my greetings to Shri Anand Srivastavaji and all the other speakers of this panel. That is Dr. Sheshadriji, Dr. Anand Dashputre, Pradeep Sehgal, and Dr. Subhash Chandragupta. So I thank you, the organizers, for inviting me to be a part of this platform. So thank you so much. And first of all, I would like to congratulate Maharshi Ayurveda for conducting such refreshing webinars, which help motivating the youngsters and gain confidence in Ayurveda medicine. And I thank you for making me a part of this platform. Thank you so much. And secondly, I would also like to appreciate the quality of medicines Maharshi Ayurveda is producing. And this plays a major role in providing the desired results. So this is very important. And as in the last webinar, Anandji had told us how Maharshi ji gave importance to the quality of medicines. So as said, as the saying goes, whatever begins good will always end good. So Maharshi ji's dream has been fulfilled with the help of good medicines Maharshi Ayurveda is producing. I'm able to tell all these things because every day I'm using all these things in the practice. So thank you so much. And now as Anuj ji told that I'm working as a consultant in Maharshi Vidya Mandir in Hosur. It is a school wherein about 8,000 students are there. And here I'm happy to say that we are giving Ayurveda medicines as first aid to the kids. And most of the kids are very happy with the medicines, and the parents are also feeling very good with the medicines that we provide to the kids. And a very big thanks for the management for providing this opportunity. And management is doing a lot of things to give good things to the students. And one among this is medical help. So coming to the topic, I will like to share my screen. So can this happen, Mr. Anuji? Oh, it is disabled. I wanted to present a slideshow.
So you can, just a second, I'll make, okay, now you can see, ma'am, you can share the screen. Please go ahead. Now you can.
Not yet, sir. It says host disabled participant screen sharing.
So now you can see, ma'am. I have made you as a co-host.
Yeah. Thank you.
Sure.
So is it visible?
Yes, ma'am, it's visible. Make it full screen.
I have made it full screen, sir.
Okay, there's one button at the down where you can click it and make it full screen so that the other slides are not visible. The main slide, yes.
Is it visible now?
Yep. Press on the the bottom near the 66%.
Yeah, 60. I have made it.
Yeah. Okay. That's fine. Please go ahead.
No?
Please go ahead.
Yeah.
Better. Yeah.
So the topic of today, Ayurveda interventions for chronic digestive disorders. So as Mr. Pradeep Sehgal just now told that Agni is very important. So here also we concentrate on the Agni for the treatment of all the diseases. So Ayurveda would be the best choice for the digestive disorders especially. So we have a lot of medicines which can help to cure the digestive disorders, whether it is acute or chronic. I would suggest everybody to go in for Ayurveda rather than going for anything else. So before treating any disease, Ayurveda concentrates on the prabalata of the Agni, that is the Shakti, that is the power of the Agni, especially in the disorders related to the Annavahasrotas. So there are numerous medicines in Ayurveda which can help to bring back the normalcy in the functioning of the Agni. So we all know that Ayurveda has so many medicines which help to cure the digestive disorders. So first of all, but before knowing what is the disorder, we'll have to assess the Agni of the patient. So whether it is a Mandagni, Tikshnagni, all those things we'll have to assess. So without assessing the Agni of the patient, we cannot give him any medicines, because whatever the person consumes, it mainly depends on his capacity. So whether we have to give a Tikshna medicine or a Manda medicine, all these things depends upon his Agni. So small recap regarding the Agni. So Agni is of 4 types according to our Ayurveda. So, and this classification is based on the dosha predominance. So we all know that there are 4 types of Agni. It is due to the predominance of dosha. It's Mandagni because of the kapha, wherein how the annapaka happens is alpalpam api naiva pachyate. That is, even small quantities of food, even if the patient is taking, he is not able to digest it, or he takes it a long time to digest. So this is because of the kapha dosha predominance. And Tikshna Agni, here pitta dosha will be predominant, wherein the person, if he takes matravat bhojana or ati matravat bhojana, then all these things becomes sukhena pachyate. It is digested easily. So any amount of food that he takes, or whatever type of food he takes, it is easily digestible for him. So this is Tikshna Agni. And then Vishamagni is because of the Vata predominance, wherein sometimes it is easily digested or properly digested, and sometimes it is not digested. This is Vishamagni. And coming to the Samagni, that is because of the Samadoshaja, here all the food is Samyak Pachate. According to the time it is digested. And all of us know that Samagni is Sarvashreshta. In order to assess the Agni, we have to elicit leading questions regarding the degree of appetite, as to what are the details of the food habits the person has. So before, how he was when he was normal, and now when he is not normal or when he is diseased, what is the food habits he is having, quantity, how much quantity he was taking, what is the quality of food he was taking before and now, so that we can assess what are the type of the Agnis that what is he suffering from, and the time of the food taken, interval of the food, and time taken for the food to digest. So all these leading questions, if we ask, then we can assess whether it is Mandagni, Tikshnagni, Vishamagni, or Samagni. So after assessing the Agni, simple measures can be adopted to bring back the normal strength of the Agni. So we all know that in Mandagni, Shleshma Nigrahana has to be done. So here Katutikta Kashaya Annapanna can be taken. In Tikshnagni, Pitta Nigrahana can be done. Here Madhura Tikta Kashaya Rasas can be used, or the Dikshira Payasa. It can help in reducing the Tikshnagni. Mostly Tikshnagni will lead to Bhasmaka Roga. So here the Dikshira and Payasa would be helpful. And then coming to the Vishamagni, here Vata Nigrahana has to be done with Madhura Amla Lavana Rasas, and Snigdha Bhojana has to be done. So few simple measures can be done to increase the Agni. That is, Deepana and Pachana can be done with few simple medicines that are available in Ayurveda, which is easily consumable. First one I would like to tell is regarding Pathyadi Churna. So in this Pathyadi Churna has only 3 ingredients: Haritaki, Pipali, and Saindavalavana. So all these things, they have to be taken in equal quantity, and it has to be consumed either with mastu, that is Dadhi mastu, or with Ushnodaka. So Dadhi mastu for Tikshnagni, and for all the other Agnis with Ushnodaka, this has to be taken. And it is told that this Pathyadi Churna can cure any type of Ajirana that would have occurred. And next one is Hingvashtaka Churna. So Hingvashtaka Churna, it is taken with the first morsel of the food along with ghee. And then Vaishwanara Churna with Ghruta or Ushnodaka, it has to be taken. And Bhaskara Lavana Churna also with Ushnodaka or even buttermilk, it can be consumed. And some of the patent medicines that I have come across gives good results in digesting these or treating the Ajirna or any disorders related to the digestive system. So Dizomap, Livomap, Amlant, these are all Maharshi Ayurveda products. And also I have found very good results with Karmicot, Acidacot, Aptois syrup, and Aptizum syrup. These are all the patent medicines which are really working good. And coming to, I like to present a few two cases which I have come across and got a good result. So first case I would like to share with you is a Hindu male patient around 50 years. So he was a Pittavata Prakriti person, and he had constant complaint of pain abdomen. Since 6 to 7 years, he was complaining with this problem. He had frequent urge to pass stools. There was bloating of the abdomen, that is, anaha was there, and reduced appetite. So these were the presenting complaint of the patient. He had a history of gastritis. What he told gastritis as was epigastric burning, occasional vomiting. Since 10 years, he was having these problems. And there was no history of diabetes mellitus, hypertension, or any other systemic disorders. So what I did was, I started with Deepana and Pachana. I started since he was a chronic gastritic patient. I started with Hingvashtaka Churna and Amlant tablet. So these two were given for 3 days initially. Hingvashtaka Churna half teaspoon I gave because his Agni was not very good. Half teaspoon BD I gave, and Amlant 1 TID before food was given. After 3 days, I started with Levomap, Dizomap, and Himcospaz was given as a, so as if we had severe pain in the abdomen, he could have, I asked him to take Himcospaz. So within 10 days, he came back saying that his digestion and appetite had improved, bloating got completely reduced, but mild pain in the abdomen was present on and off, and but not continuously very much as before. But satisfactory bowel movements was also not there, and the frequency of the bowels also had increased. So then what I did, I continued Ashtachurna, that is Hingvashtaka Churna and Amlant, and then added Avipatikara Churna. So this Avipatikara Churna I added to facilitate proper mala pravriti. So though he had frequency of bowel movement was there, but proper evacuation was not there. So I added Avipatikara Churna. Also I added Mustakarishta and Sarivadhyasava to control the pitta. So after 15 days, the patient was relieved of all the symptoms. Later on, I also advised him to continue Amlant tablet whenever required, and to consume Ajamoda Sadhita Jala frequently to keep his Vata and Agni in good condition. So this was regarding one case presentation. The next one I would also share with you regarding another patient who was a female patient aged 45 years, and this patient was Pitta Kapha Prakriti. So she had a complaint of frequent headache, nausea, vomiting, gastritis, and loose stool since 8 to 10 years. Almost twice a week she was having this problem. Always she used to take some painkillers or some Digene or something like that, and she used to be okay with that. But the problem was not cured. So, this patient also did not have any systemic disorders, and but her koshta was mridu. It was mridu koshta, and sattva was also very avara. So small changes in the if she had stress also, all these symptoms would arise. So what I did was, I started on the line of Amla Pitta Chikitsa. So concentrating on Pitta and Vata dosha, and here I administered Amlant for 3 times a day, 1 before food, Maharasnadi Kashaya 3 teaspoons before food, and Hingvashtaka Churna half teaspoon with food, and Niarjim tablet 2 BD after food. So within 1 month, I could see that the frequency of her headache, it had reduced to once in 15 days. That which was there once in 3 or 4 days, it reduced to once in 15 days. And after 3 months of continuous medication with tapering doses of medicines, gradually I started tapering the medicines. So within 3 months, she was feeling completely better. But still, since her koshta was mrudu, she always had to take she also always had to control her cravings regarding the spicy and oily food. And I, even for her, whenever required, I asked her to take Dizomap and Amlant frequently. So these were the 2 cases that I really found very good results. And so this is the one that I wanted to share with you people. And thank you for providing this opportunity. So I also want to share regarding the place I work, where this is Maharshi Vidya Mandir. This is the aerial view of our school, and it provides a lot of facilities to the kids there. And one more thing is, it also gives good importance to the transcendental meditation. All the kids do the meditation twice a day, and also yoga is being practiced there. and we have medical facilities also. 24/7 medical facilities is there. So this is the one thing which I wanted to share with you. So there was one other slide, but it is not moving. The slide is not moving. So thank you. And I also wanted to add one more thing. So as Mr. Anuj told regarding the diarrhea that is present in COVID cases, I also would like to share that Ambimap is giving good results in case of diarrhea. So that we can use. And I would like to tell, if apart from the medical fraternity, if somebody else is also seeing. Hello, Mr. Anuj, am I audible?
Yeah, ma'am, very much audible. Please go ahead.
Hello?
Yes, ma'am, you're audible. Please go ahead, ma'am. You're audible, ma'am. Hello?
Hello?
Yes, ma'am, you're audible. You're audible. Please go ahead, ma'am. Hello? Ma'am, can you hear me? Ragini, ma'am, can you hear me? Hello? I think we have lost, I think, Ragini, ma'am. So nonetheless, ma'am has kind of covered all her points very well. She spoke very, very well, and I'm very thankful for her in-depth case study presentations that she has done. 2 cases that she has presented. Moving on, if I'm audible to all, Dr. Pradeep and Kapil and all, I'm audible. Yeah. Okay. So moving ahead, we have Dr. Anand Dashputre from Jalgaon. Dr. Anand Dashputre is the past president of the Ayurveda Vidyapith Jalgaon, the medical committee chairman for the 3 consecutive years. He has more than 21 years of experience in the field of Ayurveda, Chikitsa and Panchkarma. And Anand has delivered more than 100 lectures delivered on All India Radio, TV, and penned many articles in renowned newspapers and magazines. He has attended also many presentations, posters, and seminars, both India and worldwide. Sir is also the past president of the Ayurveda Vidyapith Jalgaon, and sir has presented a poster on migraine and its management at the International Ayurveda Congress held at Netherlands. And sir is an avid athlete, and at various regional and national marathons he has participated, being the marathoner at the Tata Mumbai Marathon. He is an avid painter and a swimmer. So over to Dr. Anand for the address. Doctor, please go ahead with your address.
Hello.
Yes, Doctor, I can hear you.
Good evening to everyone. Respected Chairman Sir, Anand Srivastav Sir, Anuj, my friend Anuj and team